What if I told you that many women with uterine fibroids may no longer need major surgery to feel better? For decades, hysterectomy, that is removal of the uterus, was considered the standard solution for painful fibroids. But today, modern pinhole procedures are changing everything. Smaller cuts, faster recovery, and in many cases, uterine preservation. Uterine fibroids are extremely common. They are a non-cancerous growth that develop from the muscular layer of the uterus. Some women never notice them, but for others, fibroids can completely disrupt their daily life. That is, heavy bleeding, severe cramps, bloating, pelvic pressure, back pain, frequent urination, or even fertility problems. The biggest fear what women have is, will I lose my uterus? Fibroids grow because they receive strong blood supply and respond to hormones like estrogen and progesterone. Traditional surgery remove the fibroid physically, but newer, minimally invasive procedures work differently. They target the blood supply itself. One of the most advanced option today is called as Uterine Fibroid Embolization or UFE. This is a pinhole procedure performed by an interventional radiologist. Instead of making large abdominal cuts, a tiny catheter is inserted through a small puncture, usually near the wrist or groin. Using real-time images, the doctor navigates directly to the arteries feeding the fibroid. Then tiny particles are injected to block the blood supply. Without oxygen and nutrition, the fibroids begin to shrink naturally, and following weeks, without oxygen and nutrition, the fibroids begin to shrink naturally over time, that is, weeks to months. The healthy uterus continuously receiving blood from other vessels, but the fibroids slowly weakens. The reason many patients choose pinhole procedure is because recovery is often much easier compared to open surgery. Benefits may include no large scar, short hospital stay, quicker return to work, and because multiple fibroids can often be treated at once, it's especially useful for patients with several growing fibroids in their uterus. But not every fibroid patient needs the same treatment. Some women may still be benefited from myomectomy, hormonal therapy, or surgery depending upon the size of the fibroid, location, fertility goals, age, and overall health. That's why proper imaging, especially MRI or ultrasound mapping, is critical before deciding on treatment. And one important thing to understand is no treatment can guarantee fibroids will never recur again. Fibroids are influenced by hormone and genetic factors, but modern minimally invasive procedures can dramatically reduce symptoms and improve quality of life without removal of uterus. So, if you have been told hysterectomy is your only option, it may be time to ask about minimally invasive fibroid treatment, because today treating fibroids is no longer just about removing organs. It's about preserving the health, recovery, and quality of life with smarter technology.